Ever wondered how our respiratory system works and what happens when it's affected by diseases like COPD and pneumonia? Well, prepare to have your curiosity satisfied. Our bodies are like finely tuned machines, and the respiratory system is a critical component of that machinery. The main function of the respiratory system is to transport oxygen, a gas which our cells need to survive and function effectively, into our bodies, and to expel carbon dioxide, a waste product of cellular processes, out of our bodies. So how does this happen? The journey begins when we inhale air. This air, rich in oxygen, travels down our windpipe, also known as the trachea, and into two large tubes called the bronchi. Each bronchus leads to one of the lungs. Within the lungs, the bronchi branch out into smaller tubes, culminating in tiny air sacs called alveoli. The alveoli are where the magic happens. These small sacs are surrounded by tiny blood vessels called capillaries. The oxygen in the inhaled air passes through the thin walls of the alveoli and capillaries, entering the bloodstream. At the same time, carbon dioxide, a waste product from our body's cells, is passed from the blood into the alveoli. This carbon dioxide is then exhaled out of the body, completing the gas exchange process. The diaphragm, a strong dome-shaped muscle located beneath the lungs, plays a pivotal role in this process. It contracts and flattens when we inhale, creating a vacuum that pulls air into the lungs. When we exhale, the diaphragm relaxes and returns to its dome shape, pushing air out of the lungs. Understanding how this system operates and the crucial role it plays in our survival and well-being highlights why maintaining respiratory health is so important. It also underscores the severity of conditions that compromise this system, like chronic obstructive pulmonary disorder and pneumonia. Now that we understand how the respiratory system works, let's delve into what happens when things go wrong. Imagine a simple task like breathing becoming a daily struggle. That's what it feels like to live with chronic obstructive pulmonary disorder, or COPD. This is a common, often misunderstood condition that affects millions around the world, making each breath a laborious effort. COPD is not just one disease, but a term used to describe progressive lung diseases including emphysema, chronic bronchitis, and refractory asthma. Now, let's imagine the lungs as an inverted tree with its branches being the airways. In a healthy lung, air travels freely through these branches, right down to the tiny air sacs where oxygen is absorbed into the bloodstream. But in the lungs of someone with COPD, these airways and air sacs are damaged, becoming less efficient at their job. So what causes this damage? The most common culprit is smoking. Yes, that's right, the very act of inhaling smoke causes chronic inflammation, leading to narrowing and scarring of the airways. But it's not just smoking. Exposure to certain gases or fumes in the workplace, air pollution, and even genetic factors can contribute to developing COPD. The symptoms of COPD are often brushed off as just a smoker's cough or signs of aging, but they can be alarm bells. Shortness of breath, especially during physical activities, a chronic cough that may produce mucus, frequent respiratory infections, and fatigue. These are all signs that your respiratory system may be under siege. COPD is a serious, life-altering condition, and the damage it causes to the respiratory system is unfortunately irreversible. It's not just about struggling to catch your breath, it's about a reduced quality of life, with everyday tasks becoming increasingly challenging. And let's not forget, it's a leading cause of death worldwide. But there's always hope. Science and medicine have come a long way, and while COPD cannot be cured, its symptoms can be managed, and progression can be slowed. So, what are these treatments? How can life with COPD be made more manageable? Stick around to find out. There's no cure for COPD, but don't lose hope. There are treatments that can help manage the symptoms and improve quality of life. First, let's talk about medications. Bronchodilators, for instance, are drugs that help open the bronchial tubes to allow more air to flow through. They come in short-acting forms for quick relief and long-acting types for ongoing management. Inhaled corticosteroids are also commonly used to reduce inflammation in the lungs. For severe symptoms, doctors may recommend a combination of these medications. Next, we have oxygen therapy. This is a treatment that provides extra oxygen to your lungs, which can help you breathe easier and get more active. You might use it only during activities or while you sleep, or you may need it all the time. The aim here is to maintain a sufficient level of oxygen in your blood to keep your body functioning correctly. Pulmonary rehabilitation is another crucial aspect of COPD management. This is a program that combines education, exercise training, nutrition advice, and counseling. It's designed to help you stay active and carry out your daily activities without feeling short of breath. The program can be tailored to individual needs and conditions, making it a flexible and effective approach. But treatments alone aren't enough. Lifestyle changes play a significant role in managing COPD. Quitting smoking is the most important step you can take. It's never too late to quit, and there are many resources available to help. Regular exercise can also improve your lung capacity and overall health. Even simple activities like walking or cycling can make a big difference. Lastly, healthy eating is essential. A balanced diet can help strengthen your immune system, maintain a healthy weight, and provide energy for physical activity. So, fill your plate with plenty of fruits, vegetables, lean proteins, and whole grains. While COPD is a chronic condition, proper treatment can help manage its impact. But what about other diseases that affect our respiratory system? Let's talk about pneumonia. Pneumonia is another common respiratory disease that can seriously impact your health. This is not just a simple cough or cold, rather, it's a more serious condition that affects the lungs and can be caused by a variety of culprits, including viruses and bacteria. Let's imagine pneumonia as an unwanted guest that enters your lungs. It causes inflammation in the air sacs, also known as alveoli, filling them with fluid or pus. This causes a variety of symptoms, and they aren't exactly the most pleasant. You might experience a cough with phlegm, fever, and even chest pain. At times, it could get worse, causing difficulty in breathing and shortness of breath. The main culprits behind pneumonia are bacteria and viruses, with the most common being Streptococcus pneumonia. Viruses, on the other hand, are usually those that cause colds and the flu. Let's not forget about fungi, another cause of pneumonia, especially in individuals with a weakened immune system. Now, here's where things get tricky. The lungs are responsible for oxygenating the blood. When pneumonia strikes, the inflammation and fluid buildup in the air sacs can hinder this process. The body may struggle to get enough oxygen, leading to fatigue and other health complications. It's like trying to run a marathon while only being able to take shallow breaths. Not an easy feat, is it? Pneumonia can affect anyone, but it's particularly severe in infants, older adults, and those with other health conditions or weakened immune systems. It's a bit like a sneaky thief that targets the most vulnerable. But here's the good news. Pneumonia is treatable. With the right course of antibiotics for bacterial pneumonia, antiviral medications for viral pneumonia, and antifungal treatment for fungal pneumonia, most people can recover fully. It's essential to get medical help promptly if you suspect you have pneumonia. The faster you get treatment, the better your chances of a full recovery. Pneumonia can be severe, but with the right treatment, most people recover fully. So, if you're ever hit with a persistent cough, fever, or chest pain, don't brush it off as just a common cold. Listen to your body, it's usually telling you something. Caught in the grip of pneumonia? Don't worry. Treatments are available that can help you recover. Let's dive right in. Pneumonia is primarily treated with antibiotics, tailored to the strain of bacteria causing the infection. The key here is to take the full course of medication to ensure all bacteria are eliminated and to prevent any resistance from developing. In addition to antibiotics, rest is crucial for recovery. Your body needs energy to fight off the infection and heal. So it's important to take it easy, get plenty of sleep, and let your body do its job. Remember, it's not a sign of weakness to rest, it's a sign of wisdom. Hydration is another essential part of treatment for pneumonia. Water helps to thin out the mucus in your lungs, making it easier to cough up and helping to clear the infection. It also keeps your body functioning optimally, which is especially important when you're under the weather. Now, let's take a moment to recap what we've covered in this video. We started with an overview of the respiratory system, taking you on a journey through its intricate workings. We then delved into chronic obstructive pulmonary disorder, or COPD, a long-term, progressive disease that can make breathing a real challenge. We explored the various treatments for COPD, which aim to manage symptoms and slow the progression of the disease. Next, we turned our attention to pneumonia, an infection that inflames the air sacs in one or both lungs, which can fill with fluid or pus. We've just discussed the treatments for pneumonia, which primarily involve antibiotics, rest, and hydration. So there we have it, a journey through our respiratory system and some of the diseases that can affect it. We hope this video has been informative and enlightening. As always, knowledge is power, and understanding these conditions can help you take control of your health. Subscribe for more, because you won't find me later.